A technique that's been used to help burn patients is now being used to erase birthmarks. Not the so-called beauty marks many people have, but the huge dark patches of skin called giant nevi. They can cover a person's entire face, arm, leg, and they're not only disfiguring, they're potentially dangerous.
5-year-old Elizabeth Morales is a cute little girl, but there was nothing cute about the birthmark she used to have on her back.
It was dark, it had patches of other birthmarks on it, and then to top it off, it had hair on it.
And these birthmarks, or giant nevi, can turn into skin cancer.
And so we have both a cosmetically very horrifying looking thing, and also a risk for changing into cancer. So you couldn't have a worse situation.
The solution? A cultured epithelial autograft, CEA for short. It's a sheet of skin grown from a tiny piece of the patient's own tissue.
And from a small postage stamp sized area of skin biopsy, we can actually grow in the laboratory enough skin to resurface almost the entire body.
Using a technique that's been successful with burn patients, the damaged or pigmented skin is removed and the area is covered with squares of cultured skin.
They're so unlike anything you've ever dealt with before, and so unusual that you almost can't believe that this is real.
But the results can be real enough. This is a burn patient before, and this is 9 months after. Elizabeth is still healing. A pressure suit helps control the scarring.
My hopes are high already. There's no way to turn me down because she's done so well. I mean, the doctors are all so happy on how she recovered.
Other techniques can sometimes be used for people with birthmarks like Elizabeth's. But when those aren't an option, CEA may be the answer. This is Mike Lyon reporting.
There are about 200 burn centers in the United States, and probably half of them are using or have used CEA technology. Very few places, however, are using it on patients with other types of problems, like the giant nevi. The doctor says he expects it will be tried more and more, not only on people with very large birthmarks, but perhaps on people with chronic ulcers or even tumors as well.